Hi, this is Rohrich. Welcome back to Rohrich Knows Podcast, helping you become a better you. We've heard a lot about plastic surgery and who has it, who hasn't had it. And, sometimes I think people are age shaming when they say, oh God, they haven't had plastic surgery. And I think I think that's a great thing to not have plastic surgery. And recently it's been focused on a few stars like Justin Timberlake and Brooke Shields, who say, well, have they really had plastic surgery? They don't look like they've had plastic surgery. And I say more power to them. I mean, let's take Justin Timberlake. I mean, he's a good-looking dude, and he's very talented. And I really don't think, when I look at him, I don't think he's had plastic surgery. I mean, he's probably had Botox like everybody. I mean, I've had Botox, and I've even had fillers, but that's okay. I think he's very comfortable in his own skin, and as he should be. He's talented. He's a good-looking guy, and so I think that's okay. Now to say, oh yeah, he didn't have plastic surgery, or look how he's not transformed and how he's aging, I think I think more power to him. I think Justin Timberlake, he's a rock star, and I think he looks good as he is today. I mean, obviously when you compare him to when he was 20 years old, that's a little different, but it's all the power of, we live on the planet Earth. That's called gravity, and everything sinks downwards, so that's fine. So, and then another famous example, of course, is Brooke Shields, who talks about, she doesn't want to do any plastic surgery or is afraid of it. You know what? That's great. First of all, she's beautiful. She was beautiful years ago, and she's certainly beautiful now. And she's, again, very highly talented woman. However, I think it's an individual choice whether you want to have plastic surgery or, you want to always look and feel yourself, and some people say, well, I want to, look as good as I feel. That's fine. And, the corollary of that is also true. If you want to look better, you can have plastic surgery. And if you look as good as you feel now in whether you're 20 or 30 or 50, fine. I think that's who you are. So I think to kind of label people say, yeah, I've had plastic surgery or not, I think that's not really, I think, appropriate. But if people have had plastic surgery, and certainly another famous star that actually, Gwen Stefani, she's certainly has gotten plastic surgery. She's admitted to it, and she looks awesome too. And I think that's fine. I think it sure is better than some major influencers, that will say they've never, like Kim Kardashian said, I've never had anything but Botox. I mean, come on. I mean, okay, maybe, but maybe not. So I think what people appreciate is, just be open and honest, because today having plastic surgery, I think it's okay. It's normal. And everyone, I think the advent of social media and, all kinds of reality shows have said that it's okay to have plastic surgery and it's okay to not have plastic surgery. So the who done it, who did it, who didn't, I don't think that really matters so much today. I think what really matters is that people are open and honest about what they did and what they didn't do. I don't think it matters at all. And there's all these reaction videos that you see on YouTube about people that have had plastic surgery or denied it. And it was a big deal when Bella Hadid came out and said that she had plastic surgery, and I think she was like 14 and really didn't really want to do it. And today she regrets it. And I think that's fine. I personally admire her for saying that, I probably was too young to have plastic surgery then. But I mean, I think that's being open and honest versus, saying, I never had anything done. And of course, we all know one of the things as a plastic surgeon, we know when I look at somebody, I know fairly well whether they've had plastic surgery or not, I think it's probably a curse, because when I'm in an elevator and I'm looking around, and I can see exactly who's had and has not had plastic surgery. It's like going on a plane, it's just normal. It's kind of a curse because you say, okay, yeah, this person obviously has had plastic surgery or not, and many times it's great plastic surgery. So I think the myth of saying, oh, he or she's had plastic surgery, that's, a stereotype, I think that's gone. I think the real reality is that, wow, you look awesome. Doesn't matter what your age is. You may be 50, 60, 70, but man, you look awesome. And that is really the hallmark of really great plastic surgery, when you can say, wow, you look awesome. I mean, Jane Fonda, she looks awesome. Now, she's had several things done in her face, and I think, but she hasn't denied that, but she looks awesome. But it's also a healthy lifestyle, and I think that's what's also great, is that, you can't just have plastic surgery. You gotta, do all the tenets. You gotta obviously be healthy, exercise, do yoga, use sunscreen, use retinoids, all these basic anti-aging factors that are so important to help you, age greater and better. Not saying gracefully, but just to age in a better manner. And I think all of us can do that. And certainly, when we live in climates like in Texas, where the sun is very, very, very hard on your skin, it really will age you. So you can do things that will help you minimize that. And that's really all that you want to do. So the take-home message here is, be yourself. You're living in your own skin. Life is not a dress rehearsal. So you want to look as good as you feel. And you want to be age appropriate for what you want to do. You just don't want to look like a different person, and I think that's the most important thing is, and if you have plastic surgery, make sure you see a board certified plastic surgeon, someone that really understands your concerns, but also has a talented expertise to give you the result you want. And you can do that in multiple different ways by telling them what you want and what you don't want. You can show them photos. You can show them photos of noses or faces that you like or don't like. Those are very important. But for me, I like to listen. You have to be an active listener. I listen to my patients. I listen to what they're telling me and also what they're showing me. And then I do computer imaging to show them exactly what I can potentially do. It's not an exact science, but it gives them an educational view, because today people are very visual. They want to see kind of what the result is from a facelift or a rhinoplasty. And it gives them a good approximation. It's never 100% accurate, because, we're not God, but an imaging does help you. And I think that's really, really a byproduct of social media, and it's different than doing morphing, but just giving an image of what's possible. Your shape of your nose, you're bringing your cheeks back, you're actually correcting your jawline. Those are all things that people want to look at, and I think it's good for them to see that and to see a younger version of themselves. So please give me your comments, give me your thoughts, see what you think about aging. Aging is really it's a personal trait. We all undergo aging. No one gets out of here alive, and we live on planet Earth, so guess what? Gravity supersedes everything, including plastic surgery. So enjoy it. Hope we helped educate you to be a better, more informed you about how we age and what you can do to help yourself look and be the best you can be.